I'm Dr. Sabria Rashid from Tanzania, working with Manipal National Hospital. I've been recommended to have an infertility course by Ministry of Health, and my studies here have been supported by Merck Foundation. The challenges that we are facing, as Tanzania is one of the developing countries, therefore we have first, the challenges that I would think of is professionals. We have limited number of professionals. People with reproductive health medicine are very few, and as much as I know, this infertility unity has to be organized with as a unit with infertility specialist, embryologist, lab technician, and everybody. Therefore, we have limited number of professionals in all that aspects, and as well as it's a poorly resourced countries. Therefore, having a well-structured infertility unit could be of a challenge as well, as it is among the poor countries. But as well, another challenges that we are facing is socio-economical and regional aspects in the case of infertility, as the religious aspect and social, and as well socio-demographic can influence in some issues concerning the infertility. Being a gynecologist, I've been facing patients with an infertility, and I've been trying to manage them as much as the knowledge that I have. And therefore, with this growing infertility issues, I had some interest in infertility, and Merck Foundation with this sponsorship has actually helped me to get the keen and deep knowledge on infertility to myself, and I take this opportunity to thank Merck Foundation so much for the offer. In case of infertility, probably in many countries in the world, the most affected person is a lady, and I think it's the same in my country. So much of it will go condemning the ladies, but as to my knowledge now, and here I get to know that even male are equally affected. And so it's the same in my country, even though they most of them don't want to come for checkup. And if they come, they would wish to hide the information to their wives. Therefore, it's a challenge on management. But all in all, it can either be taken as a ladies' issues or a caste issues, so it has got an effect on the cultural, and I think it's the poor knowledge people has. Actually, they have poor knowledge on it, and hence they can conclude irrationally. Taking a course in clinician in infertility, I was expecting to know much of the knowledge on the causes, how to diagnose, and how to treat them, and the challenges that I'm going to face in infertility as a whole. So, first time when I got here, it was seems to be a very curriculum. Let's say, the plan was too much, but in a way, when we were starting, I get to understand things slowly, and we had a lot of lectures, which are intense, and as well as some simulators in a lot of activities that are needed in infertility. Therefore, we had a chance to go to do activities in simulators in the ultrasound, transvaginal especially, hysteroscopy, and as well as embryo transfer and ovum pickup. And in hand, we also did a practice at the same time. Therefore, lectures and simulators and hand-on went simultaneously. And I think I acquired much of the knowledge that I would wish to acquire. For anyone who would wish to go for further studies, if it happens in the countries there is a hospital or any center for infertility, I would really wish for someone to at least have some time with the centers and get a little knowledge before coming for further studies, which is a difficulty, and that's why some of us were here for further studies, because we couldn't get that from home. So if anyone would wish to get more knowledge, I think coming to, for example, my experience in India here, I think it was very, very supportive. And I think because it is also nearby, we are like having the same socio-economic issues, like whatever they have, it is easy for us to improvise in my country. I think we can go for further studies as recommended. But the little knowledge, having little knowledge before coming would be of help as well, even if we get a short course or reading through details on infertility. With the course detailed, the knowledge that I acquired here, first of all, I think it has got an effect on me as I've become much more professional and detailed and getting to manage the infertility in much more advanced level. 1. 2, I think that will have as well make the best management to my patients. In my country, I will try to help colleagues and young doctors. I will try to teach them on everything that I've been learning here, including theoretical and practical aspect. I would like to take this opportunity, first of all, to thank the Muhimbili National Hospital organization for giving me permission to come for further studies, but as well organizing with the Ministry of Health, with the support of Ministry of Health, to connect me through Merck Foundation and be here in Indira Institute for my studies. Tanzania.